personal power, people positive, the community of connection. This is the Bob Jeswald Show.
2023 already, and I'm here with Dr. Hunter Champion, cardiologist extraordinaire. He's written so many papers. We had him on many other episodes. You can check it out right here. Look in your episode guides, wherever you get your podcast. Dr. Champion is someone who actually writes papers. He does so much, PhD, MD, the whole shebang. And even the broken heart syndrome, we talked about that. We're always talking about heart health. We're talking about health and fitness here on the Bob Jeswald Show. And the exclusive tonight, we're talking about sudden death in athletes. You're affiliated and linked with professional sports, and you're the best guy I had to call on. Usually you come on anyway, but I'm like, I got to get Hunter on here like now, pronto. And it all started with me. I'm from Buffalo, New York, as you know, and I'm watching the Buffalo Bills and Cincinnati Bengals. The most disturbing play in to see a safety make a tackle and stand up looking good and then fall backwards like, what in the heck is going on here? He didn't die. Just when I tell we're talking about Mr. Hamlin himself. Right. And Damar Hamlin, we found out he had some weird conditions. We just don't know. And your profession, do you see these kind of things often? Because it strikes me differently. You think, well, gosh, they tackle like this all the time. Right. I mean, he's the unlucky one in how many, a million hits or more, and he gets this condition, which is type of myopathy. What tell us what happened, you think?
So sudden cardiac death is something that is not terribly uncommon, but it's also something relatively rare in the athletic community. For the last 30 years, we've had averaging 20 to 30 of these across sports per year.
Sure, okay.
So it's relatively rare in that regard. Most common sports that we see it with, though, are primarily basketball, soccer. Football is a little bit lower on the list, but there are a lot of different predispositions you can have for sudden cardiac death or a sudden event like this. Some are hereditary, some are acquired. So whenever something like this happens, obviously it jars us because we have young people in peak athletic ability. We think a lot of professional sports. I mean, heck, with my experience in professional sports, these people are well screened. They get echoes on a regular basis. I have them do cardiopulmonary testing on a regular basis and that type of thing. And to have something like this happen really does, it jars you.
It blew our mind. I mean, I'm looking, I started thinking about, we've talked about this in past episodes, about the Widowmaker, or somebody, in the example you told me that there was a guy, he was, just ultra marathon runner. He's doing this for forever and hundreds of miles. And he goes, and most people say, well, what do you expect? He's running hundreds of miles. But this guy had no problem at mile 100. But all of a sudden he hits this brick wall. You check him out. Widowmaker would have been dead, but you fixed the problem.
Right.
With an athlete again, working with professional athletes as you do, you see a situation. I don't know if you were able to see that game, but to witness that it was heartbreaking. I mean, literally, I don't mean that as a play in words here, but you say to yourself, he's 24 years old.
Right.
How in the hell does this happen? And so to hit like that, it made me start thinking, of course, my mind thinks like, okay, how many times does this happen in sports? Baseball, let's say if somebody got a ball and hit him in the chest. How many ball players I see fall down and have a cardiac event? I mean, lack of oxygen in the brain. Clearly, the first responders get a big praise. Right. I mean, they did everything right to keep him alive, to get the oxygen. I think we all have figured that out. Call AED. You're there on the field. They're doing compressions, and at the same time, they're giving him air going in his lungs. Although if it was just somebody else that's doing compressions for that long before help would arrive, I don't think they would have been alive.
Right.
So he came very close to sudden death. Is it typical, though? I mean, you say it's not very often, but that kind of hit? I mean, why has it got to be that hit? It's got to hit just right, I'm understanding.
Well, so a couple of things there. One, there's a condition called commotio cordis, and what that is it's a fancy way of saying that you have a projectile that hits the chest at the right spot, but it's really more about timing. So that can actually happen in a totally normal heart. And what happens is you have a sudden, shock to the chest from a ball or a hockey puck, and it hits the exact right spot in the EKG rhythm. And then when that happens, it sends you straight into ventricular fibrillation. Now, that's by far most common. With the few times that I've seen it personally, right there, it's been baseball, so a line drive to the chest, a baseball bat to the chest.
Sure.
Lacrosse ball is very common of those, hockey puck, especially when people aren't wearing pads.
Right.
We really don't see this often in football. In fact, if you think about the 1.5 million hits over the last few years, this is the first time we've ever seen something like this. So it didn't really behave quite like commotio cordis normally does. That's not to say it can't be that. Normally when we see that, so when I've seen it personally, the ball hits the chest and both the ball and the person fall to the ground at the same time.
Yeah, it's
almost
what seemed
instant.
weird. It was strange. He stood up.
Correct.
And it almost like I thought, and then it's, again, I'm definitely not a doctor here, but when you look at it logically, at first I thought, well, whoa, did his neck snap, or did he have like some brain injury, or that was the first thing. It was something neck, or his his something happened, he lost control, and boom. But I was never thinking cardiac.
Right.
And that quick stand up looked fine, and then it almost dropped like a tree being cut down. I mean, it was frightening. So when that happened, and you're saying it didn't probably look like one after seeing some of those events, like you said, the ball in the chest, or somebody. I think of even folks like in MMA fighting too, if they get punched in the chest,
Absolutely.
right. I've seen that happen.
Right.
That it'll throw them right out. Yeah, and that's rare too. But again, like you said, that event has to hit at the same time as that beat or whatever.
Correct.
To make that event take place. But in his case, it didn't really look that way.
Correct. So it could be a number of different things. When we think about sudden cardiac death in athletes, the most common thing we see is something called hypertrophic cardiomyopathy, which is called HOCM. Okay. It tends to be something we see a lot with basketball, so where people are kind of standing still and then running really fast for short periods of time and that type of thing. So that's the most common. Sudden cardiac death happens in African Americans about 3 times the incidence as we see with white or Hispanic athletes. It's by far more common in men, so 6.5 to 1 to women. But when we see that, hypertrophic cardiomyopathy, essentially there the heart is beating so fast, and because there's actually a muscle, it's essentially the septum of the heart, the muscle is large and it's thick, it's hypertrophic. It prevents outflow of blood to the rest of the body.
Gotcha. Okay.
And it's especially exacerbated with very, very fast heart rate. So the heart can't fill enough, so you really just aren't moving blood. So that's why people suddenly pass that way. But then there can be other things too. There can be things like we talked about before, like myocarditis, or but there are also acquired things too. If someone maybe has a long QT syndrome or something on their EKG and they get an antibiotic that can make that worse, that can then make them more prone to certain arrhythmias and that type of thing.
I'm jumping ahead a little bit too. I'm thinking, just my general doctor, I always say this too. A lot of times when you go to get vaccines, they say, well, you don't want to get too many vaccines in a row or so close together. So when you introduce a vaccine, I guess the bottom line is your body goes through some kind of inflammatory state, and they say sometimes the proteins are elevated around the muscle of the heart. Does that cause inflammation? I don't even know if it's even, and you can't even answer this anyway, I'm sure, because nobody would know. And we're trying. You hear a lot of stuff on the streets. You heard it through Twitter and stuff like that. That maybe he had team of the Buffalo Bills players. Some of them were maybe getting vaccinated for COVID, booster shots, if you will. Could, if he did, don't know this, but there was just a lot of stuff on social media saying that if he did, could that cause something? Do you think like that? Or
sure. I mean, certainly myocarditis, and we know that is a known thing with both COVID infection as well as with vaccination. I think Mass General just had a paper this week showing that about 4% of young people who have a vaccination can have myocarditis associated with that. You can have myocarditis that is kind of low level or in that kind of thing, and it's not quite overt in terms of I'm feeling chest pain or short of breath or things like that. But certainly anything is obviously possible in that regard.
So myocarditis, folks know there's an inflammation of the heart, temporary,
correct,
but it does recover and
usually
good. Usually, we hope
you can get myocarditis and require transplant though.
Ooh, golly!
So,
geez, how often is that? I mean, I wouldn't think happens very often, but you've seen it and heard it.
We've seen it. We've transplanted between times at Hopkins and at University of Pittsburgh. We transplanted a fair number of primarily young men. Usually, the virus that attacks is called Coxsackie virus, but other viruses can attack the heart as well. And like I said, you can get to a point where you do need transplant.
Oral hygiene is very important as part of that, as we
always
know.
Yeah, absolutely.
That makes
as well
sense.
as endocarditis and that type of thing.
Gosh. So again, and I won't spend as much time on that, but where do you think they're going to find out about that? Do you think we'll ever get the bottom line of Damar Hamlin? Would actually really happen?
It's tough to say. I think part of like when I evaluate an athlete, because part of the big question is, hey, I've got a son that's in football, or I've got a son that's in wrestling.
Makes you wonder. Yeah, that's what I'm saying. All these people listening.
My youngest is a wrestler, and so you're kind of like, well, goodness, could that happen? And so you always look when we interview families for athletic evaluations and that type of thing, we look for family history. Okay. Family history of sudden death, family history of any congenital heart disease. Certainly, symptoms play a big role. So if the young person has had any signs of performance decrement, chest pain, shortness of breath, those types of things, that piques our interest. And generally speaking, we don't do an EKG on every person going through physical sports. It just would not be cost effective. But you have to listen. So when someone has symptoms or the family history, then the first thing we generally do will be there's essentially a 14-point quiz you can ask the patient. Sure. and that kind of thing, a checklist. But we generally turn to the EKG or the ECG is one thing. Often that can show any changes in the interval. It can show hypertrophy or thickness of the heart. Okay. But then if that's at all abnormal, then we would then move to an echocardiogram, which would be a much more definitive test in terms of heart size, shape, and function.
If our heart is having a thickening wall and it's not allowing the blood to flow freely to push that oxygen, what we need to your brain, what happened with Damar Hamlin, he obviously lost oxygen and boom, everything stopped. That's it. Do we look at heart rate? Do you think our heart rate is something indication? Like if you're sitting and resting and something seems abnormal, could that be a leading indicator?
Certainly would make you say, "Hey, should I talk about this with my family practice physician and that kind of thing?" If you have irregularities, the heart rate, certainly irregular heart rhythm. Sometimes the Apple Watch will let you know if you're having any signs of atrial fibrillation or any irregularity, that type of thing. Would certainly be reasonable to talk with your caregiver.
Yeah, I would say it 100%. I've certainly went to my cardiologist, to you guys, and made sure at Southeastern Cardiology locally here that I want to make sure that I'm okay. I want to make sure that before, because I was having some weird issues. Sure. I have a little bit of runner's asthma or athletic induced asthma, and that sort of thing. And even today I was running up pills and that. But I always kind of know that I hadn't had great sleep because of my shoulder stuff. And if you're experiencing that too, sometimes your performance out there won't be so great. So I can usually tell, okay, I'm feeling a little tired. But then again, I'm doing hills. I'm doing a lot of hills through this park that I was running through. So, I know that, okay, well, this is why it's doing it. But you don't have to be panicked, but watch closely is what we're saying. Want to make sure.
Absolutely.
So athletes in general, and I think it's, sudden death in athletes, we did see kind of a little bit of an uptick. You don't hear much about it, but there was, and we don't know. We don't know anything yet. We're not going to probably know anything for years to come, whoever's listening to this podcast. But with with COVID, it's scary. You got to protect yourself. People are, you have the option of taking something or not. They got a pill form now or whatever you have to do. Some people are like, hey, look, I want to go natural, build my immunity. But there was a lot of young athletes. There was like a little peak there going in there. If for some reason that happened, and then you go out 2 days later and you start playing football, because he accelerated. I mean, as a safety man, you saw him loop around, wrap to get that tackle.
Right.
Great by the way, it was wonderful.
It was a great tackle.
I got to tell you, it was one heck of a tackle. Right. I was like, good job, Hamlin. And the next thing you're, whoa, what's going on? So he's from the time of this podcast, and pray to God, he's still doing well in 2023 here, but he was able to return from the time of this podcast home and release. So that's some great news. So that means he left Cincinnati, and so that's some good news. Could he ever play again? Because an athlete that goes through something like he just went through, would you recommend an athlete or somebody who knows somebody playing sports, college, whatever level you're listening to, high school, would you say, yeah, let him or her go back and play?
So the answer is it depends on what the underlying cause was. And so we have, in fact, there are young people. It's amazing. There are people who go through full high school football, get recruited by college. They go to college and find out suddenly they've got hypertrophic cardiomyopathy. Oh. And that ends their athletic career. And unfortunately, I've had to tell some people who were on scholarship, and that was the only way they were going to go to school, that they can't play what they love. And in general, when we see someone that has sudden cardiac death, regardless of the underlying cause, we generally at least heavily consider putting in a defibrillator, which would be essentially, it's almost like a pacemaker, but it's implanted under the skin. It's watching every heartbeat. If they happen to go back into a fatal arrhythmia, such as ventricular fibrillation, it will try to pace them out of it. And if that doesn't work, it will actually shock them.
Are you kidding me? So is there a device? It's implantable with a little box on the outside, I would assume?
Not even. It's all implanted. It's about the size of half of a pack of playing cards. We used to say cigarette pack. We don't do that anymore.
You used to roll them up in your sleeve,
right,
and
exactly.
Put them right there in your front pocket. Yeah.
But it's about the size of a half a pack of playing cards.
Wow.
It's implanted underneath the skin. Actually, now they have subcutaneous ones that kind of go up underneath the armpit almost.
Not noticeable.
And it's watching you the entire time. It's almost like having a watchdog that you don't have to feed. Shoot. But it's constantly giving you information about your heart rhythm and that type of thing. If it was something that was acquired, if it was something that it was a medicine that you were taking or a supplement that you were taking that maybe predisposed you to that, then perhaps you may entertain the idea of not putting in a defibrillator. However, once bitten, twice shy, and I think
right.
I think if you have had that episode, really we all feel a lot better having a defibrillator implanted.
Right.
Really can't play football if you've got a defibrillator in.
No, that's the catch-22.
Correct.
Right, exactly. But you survive and you live. And you
correct.
have a good life ahead. And you can watch football, but you can coach or
Correct.
something like that. But so that is interesting because we're going to find out more about what happened. It's hard to diagnose it. It's hard to see it. I think it's always because you see something so dramatic that way. And after watching that and witnessing that, it made me think, scratching my head like, oh, my God, like you said, you have a son who wrestles. I have a daughter who runs, and she's in track, and she's cross country. Could that happen to her or him? And so you want to know what happened, and just seeing, how a tackle that looks so innocuous. I mean, it was just a typical everyday tackle. Right. It almost didn't even do it, but they're very much focused, it appears, that in your world, doctors, and being, over professional athletes, that you guys probably get to know and hear different things. You share stuff like, I know aviation pilots, my brother, if something happens to a plane, he knows they're all like in a loop and they somehow talk. Like with weather, I do weather, and we all know like these events that happen. We go to conferences like, why did this happen? What was the setup? Why did it produce this? Right. Are you guys doing the same thing as cardiologists?
We do. Unfortunately, it's one of the, because we all want to know, right? You want to know exactly A, B, C, and that type of thing. I mean, still to this day, there's so much of medicine that is not known. Whenever I have a patient that comes into the hospital with a stroke, I say, listen, there's a better than 50% chance we're really not going to find out exactly what the true cause of this stroke was.
Right.
We do the best with what we've got, and then we try to do everything that we can to manage risk factors and reduce the risk moving forward. But not really. Sometimes it's not very satisfying not actually having an actual answer. But unfortunately, that's just the case with medicine in some cases, because it's just kind of a perfect storm in some cases.
Would you say, and you can tell I keep going around in circles, trying to see in different ways of finding out. Do you think by you looking at, have you heard anything, or have you talked to any friends, or could you just again, if you were to look at that replay, would you say it looked like his chest hit it, or do you think he just was very unfortunate? Because he, I think it's. I want him to play again. Is what I'm
absolutely.
I really do. I want him to play.
I'm with you, and I think at the end of the day, as I said, it did not. Even though commotio cordis kind of is when I first saw that was the first thing.
So in your mind, you're saying commotio cordis, it looks that way.
Correct. Yeah. However, it just doesn't fit with how we normally see it. That doesn't mean it can't be that, but it's just not it doesn't quite fit with the scenario and that type of thing. And of course, when we see this happen, when people are actually watching, it's incredibly scary. And there's been a huge uptick. So, as I said before, in general, we see 20 to 30 of these a year over the last 30 years. In 2021, there were 327, at least by one data set that I saw, of young athletes with sudden death. Part of it may be, is it reporting? Is it just because everybody's so keyed up now and they say, oh, hey, remember this person? We just had an 18-year-old MMA fighter.
Yeah, that's what I was just saying, the fighter 3-0. Yeah, I saw that. Yeah,
and she passed suddenly.
Yeah.
So we do see that. Is it something else that maybe acquired? Is it what part of it is it just, are we just keyed up for it now?
Yeah.
And whenever we hear it, we're like, oh my goodness, see, there was another one. So, but I think the key thing here is, let kids play. I don't think it makes a lot of sense to have people wrapped up in bubble wrap and not do anything.
Right, yeah.
If they want to play. But, I think it makes a lot of sense to say, hey, let's look for symptoms. Let's see if there is anything, congenital that we have that runs in our family, perhaps. Sometimes it could be an anomalous coronary artery that no one ever knew about.
Sure.
So
you made a good point when you said about, and I always preach this all the time. I say perspective as far as like events and something like this. Could be hyper reported now because people are more in tune to it, so you hear more about it. It's like frequency of tornadoes in my profession. People go, well, isn't there? Oh, there's more tornadoes now. The environmentalists change a little bit. People, I call it global environmental change. I like to go with that to keep the politics out of it, science up the middle. But if you look at that scenario too, it's because technology is better, and technology could detect things a lot easier. You could see movement of air moving towards you in a way from a site a lot better. You got a better insight, or literally you can dissect a thunderstorm to the point to see, okay, there's debris that's flying in here. That's a tornado. Where years ago you could not. And on the converse of that, you can even say, well, maybe less warnings, because now we can say, well, that's not really a tornado, when before the warning would go off. So there's a lot of that perspective that has to be given, as you were just saying too. Could it be? Is it because of COVID related things, whether it's to ramp up of vaccines or is it just COVID virus itself is causing this with our young athletes, seeing 300 versus an average of 20-something a year. Now, all of a sudden, we're seeing a ramp up. Is it because of media? Is it because of us? We're hyper-focused on it, and more people are reporting it maybe more accurately or whatever it may be. So, it's like lightning injury and lightning deaths, too. So, something similar to that. There's a very hyper-focus on that as well.
Sure.
So, and I go back to Damar Hamlin and his family and stuff like that. The likelihood, obviously the season's over for him this year, but to come back, gets a clean bill of health. Have you seen that happen often? I think a lot of Bills fans of mine too are going to be wanting to ask that question.
Right.
So.
I mean, and again, I think it depends on what we kind of figure out or feel is the underlying cause. So if we feel like it was an acquired issue, if it was, perhaps low-level myocarditis from the flu, could it be, that he had a long QT syndrome because of an antibiotic or something else or a supplement?
Sure.
Then I think you feel a bit more confident about being able to say, hey, as long as we stay away from that and we watch this very closely, that maybe he can come back. If, however, we feel that this is from an anomalous coronary artery, if you fix that, then maybe you don't have an issue. Right. It could be, if he's got an underlying congenital issue that, Marfan syndrome is another one you think about. In fact, that was one of the other things I was concerned about. He doesn't really fit the Marfan.
He's very
built.
Yeah, he's not the center or he's not a linebacker.
Exactly. But when we see what we see in athletes who have a problem with Marfan is a dissection of the aorta, and that can be fatal. I mean, that's something you're right. You're off in surgery.
I have a buddy who is going up to. I forget, he's actually got something like that. It actually was like it was literally splitting.
Right.
Like I'm like, oh my God! Just envision that. I can't imagine it. Like he can't do anything. He can't over accelerate. He can't get his heart rate up real high. I mean, oh my gosh, how do you do it? And he's a big guy, but he fits that. Like you said, he's a big towering guy. He was, kind of a bruiser back in the days, but he said no, he can. And he said, some guy, a surgeon that he was seeing up in Atlanta, Georgia, who was doing it. He said, he goes, "You're a dead man walking." He said this. And
that's comforting.
I'll say Paul. I can just say Paul's first name, but he knows if he listens to this, he would know. And it's scary.
Yep.
Real deal. But it doesn't fit like somebody like Damar Hamlin in a sense. And based on that whole thing, I mean, up to this point, with his history playing in high school, college, and boom, Bills get him, and he's been practicing like this every day.
And oftentimes they are vetted at least, right? I mean, if you're going to invest a couple $1 million into an athlete, you at least want to know from an echo, hey, how are we doing there? Or have to do a cardiopulmonary test every so often, that type of thing. So I think, it's a lot less likely they would have had hypertrophic cardiomyopathy.
They would have found it.
Correct.
Yeah.
Now, there is something called, there is something that where you can actually have a catecholamine-induced arrhythmia.
Okay.
And there was actually a young student here in Columbus who was running to open a door for somebody, and he suddenly fell out, as we could say, and they feel that's what happened to him. So catecholamines or adrenaline level gets up high, it triggers the heart to then go into ventricular fibrillation.
Kind of like broken heart?
Very similar to that.
Similar to your broken heart syndrome. I remember we talked about this in
Right.
past episodes, which if anybody wants to check out, Dr. Champion, we're talking about broken heart syndrome. He wrote the paper on it. So you want answers and there's many ways if I'm leaving something out, but just anything we can do. And again, it's amazing how everyone came together.
Yes.
You see how a community comes together?
Absolutely.
In the medical community, I'll just digress for 1 second for a moment. What did you think how that was handled? I mean, what do you think? I mean, you saw that unfold on the field. What did you think how the medical professionals, how did they do?
I mean, I thought it was actually great. The only thing that I think, in my personal opinion, when you're on the field, once you've established that it's not an orthopedic injury, and if someone is unconscious, then I would have liked to have seen the ambulance on the field a little bit sooner.
Sure.
Because I think it was about 9 minutes before it was on the field, and normally we have them backed up to the stadium.
And you know what? I'm glad you said. I don't mean to interrupt, but that's why I thought it was something orthopedic. It was something bone related, fractured. He's paralyzed, something like it. But go ahead. I'm sorry.
Well, and I think part of what I also think it really does show too is, I mean, how everybody in that stadium came together, and how, I mean, really everybody around the country and around the world. I mean, I believe in the power of prayer and
me too.
And that type of thing. And I think he knew that, and so and I think I'm glad they stopped the game, and I'm glad they're not going to replay the game.
Yeah,
and
found that out too. As you know, in past we don't know what happened. Did the Bills make it to the Super Bowl? Did they win, or did the Chiefs? Who knows who it was? Wild card people came into this, but yeah, and it does because they already clinched the playoff spot anyway. So yeah, it could have been maybe more in favor of the Bills, or maybe not. But they did come together, and the health professionals are down there.
Right.
they had the AED down there. Or did they?
So normally the AED is either on a cart or it's in the ambulance.
Gotcha.
You know, whenever you see an episode, an event like this, if someone goes unconscious, I mean, that you really want to try to get that AED as soon as possible.
Yeah.
And you know, it's amazing where you see the AEDs now, just because they've now become so much more affordable. You have them here in the office.
Sure, right.
You have them at the health clubs.
Sure.
Actually, I was quail hunting with somebody, and they had an AED on the buggy.
Oh, we
and
a lot of older guys are saying go out there and quail.
Well, you know, it can be an exciting thing.
Sure.
But you know, and again, it's gotten to the point now where it's so affordable that really it makes no sense to not have one if you're going to have a group of people who may be at risk and that type of thing. And they're so easy. I mean, you know, now you have these stories of 5-year-olds who they read the instructions, they put it on and save a life.
Yeah.
So that would really be the first thing. So when we see something like that, the CPR was great. I mean, really the key now with CPR is blood flow.
Yeah.
We know that getting blood flow to the brain is by far the most important part of CPR.
So call 911, get the AED if that's even possible, and then heart compressions.
Correct.
Do them, even though as far as like people are worried about, want to mouth to mouth, they don't want to do that. But if you do heart compressions to help arise, that could be life saving.
Absolutely.
Could have been if they didn't do that. I see they had a bag. Not everybody has it, so you could do it, blow air. So it's like simulating that for oxygen, nitrogen, or whatever else is in our air that he's getting. But then they're doing heart compressions too. Is that in Damar's case? Let's just say they didn't do that. For that length of time, just doing compressions, could he have survived that?
He certainly could have. I mean, we have people all the time. In fact, we have people who come into the intensive care unit who've had actually an extended period of downtime, and we oftentimes will bring them in, we'll cool them down to try to preserve brain function, and then as we light them up, they come back. And I've got a few people who I've told that are walking miracles because they were down for an extended period of time where no one saw them. They had no compressions.
Sure.
They had no breathing.
Yeah.
But yeah, it is. And I think it's a good time to plug BLS and ACLS. So it's a great thing. I think every babysitter should be BLS trained.
Yeah.
So that just basic life support and that type of thing.
Yeah. So basic life support and child life support, whatever you can do. And babies too, there's even that happens with them
Absolutely.
as well. And you do it with your 2 fingers. You can go right over to,
That's
do
exactly
the compressions.
Right.
A great place you would advise too, where would they go to get this information? How should everybody get trained if you can't necessarily afford an AED in your house or whatever? Where can we get the training to
American Heart Association.
Okay.
So American Heart Association, most cities have a local American Heart. We actually have our heart ball coming up here in the next month or two.
I guess I'll be there. And I'm speaking like as if I'm asking this. I know the answer, but I want to ask you. But yeah, that's a big deal, the heart ball.
Absolutely. The heart ball is outstanding. And then, like I said, I mean, I think it's a great thing for young people and old alike just to be able to have that available so that if they have that skill, because there's nothing worse than having something happen in front of you and then not really know what to do.
Sure. And
it is simple enough. I mean, I think it's a great thing to do.
Yeah. One time I was in the gym with Fred Gramling. I'll say this, give him a little plug. He's a former Army Ranger, always Ranger, but he was retired. And we were at the local YMCA, and a guy who had open heart surgery, this is what I found out later, he just had it. He was released to do some exercise. He was on one of the, kind of the machines that were just doing like a chest push or whatever it was, and he kind of slumped. And I was looking at his face drooped, and we realized this guy's having a stroke. So yelled, get the AED. Fred got it, came over. He hooked it all up, gave compressions in between when it told us, it instructed us everything. What was probably minutes felt like hours, when you're in a situation like that. I've never in my life, I worked in a hospital skilled nursing for a short time. I was in college. I was a nurse's aide, so I got to help out. But I learned a lot, just observing and watching with people. But to be in a critical moment like that, this is the second time in my life actually saw somebody go into a respiratory arrest or something and trying to keep them alive. It's adrenaline rush.
Yes.
It's emotional. And what a feeling when he was still alive, this gentleman. He ended up passing, unfortunately. But I just remember I want to see the paramedics that were there. They commended, Freddie did all the work. I was just calming the wife down. I was doing things on the periphery of it to keep everything under control. But I just said, he said, God, you guys did a great job. You kept him alive and this and that. And it was nice to see it. But it was very easy to do because we've done it. So recommending people to go out there, the American Heart Association, to learn heart compressions. Go do that. It'd be a good place to learn. You wouldn't go to you and say, well, Dr. Champion, tell us how to do it. You want to go to the American Heart Association.
That's your best bet.
You got other things going on.
And you get certified in that type of thing.
Yeah.
But it's amazing where you can see it. I mean, I've seen it twice at a casino. One where the guy was winning on the craps table, another one where another person was losing. And so it can happen when you're up or when you're down.
Oh my gosh, that's not the way you want to go with something like that. That's for sure. But I think overall, I think people are much more inclined to nowadays to be more open, to call your doctor, to find out and do these kind of things. Listen to your body and know that. We can't preach this enough, especially on the show. Do you think there's going to be more research? And going back, I'm going to shift back to kind of the conditions like the sudden, death in athletes. Do you see any of this possibly being connected to supplements or vaccines or anything to ramp up as we went back to it again? Do you think there's going to be data? Are people collecting it just to find out?
Oh, absolutely. I mean, I think we're certainly seeing a lot of data collection. Even in Atlanta, there are a couple of really good COVID centers now between Emory and Piedmont, and there's one at UAB where they're collecting data about both COVID infection as well as vaccination. But not only that, just sudden death in general. And as the technology advances and our ability to be able to monitor people more closely, and with wearable devices and things like that, I think we are going to see a lot more information. I mean, I remember it wasn't too long ago, Barry Marin and his son Marty, who was a medical student with me at Tulane, they pioneered really sudden cardiac death, especially with hypertrophic cardiomyopathy. So, if you go back and look at all the original papers from the 80s and the 90s, that was all their work. Wow. Out of Boston and that type of thing. And, we think about basketball players dying suddenly on the court and things like that. And I think it also, too, it'll really let us know more. I think more people are open about talking about supplements they may be using and that type of thing. And certainly some supplements can affect the liver. They can affect other things that we just don't necessarily understand, especially since a lot of times the supplement market is not really regulated. Yeah. So sometimes we don't know what's involved in the formulations.
So we need to pay attention to that. Always has. And it's good. I tell my health professional, I tell you, or tell anybody, I tell my general doctor, too. I'll say, hey, when they come in there and you go to your doctor, are you taking anything? Yeah. I'm just like over-communicate. Give too much information is
sometimes,
okay.
Bob, but that's okay.
Is it okay?
We still love you.
Or sometimes, maybe it might be over the top, but I can't help myself. So I end up writing all these different things down. Like, I'm taking this vitamin D, I'm taking a D, I'm taking liquid drops here on CBD, and then I take omega-3 oil or, that kind of thing. And I don't take it every day. I take what I need. I take a Curmin for pain, and I got local pain in the shoulder kind of situation I have going on. So things like that I try to do naturally. I may slap in a leave now and again in a Proxen for 24 hours, but I don't do it every day. And like you said, just kind of miss feel it out.
My father, I take supplements as well. My father and I joke about the fact that we may be ending up with just brightly colored and expensive urine, but we're not taking any chances. And I think that, and I think, and
that's
actually,
what happens.
And I think that's actually a good point too. I think what we're going to start seeing a lot more of as well is going to be good study with supplements.
Yeah.
There's been a lot of data now in the anti-aging, group and things like that, looking at various supplements that they've found in mice and rats, et cetera, and they're doing human studies now. So a lot of things that are coming down the pike, I think, that will be useful and good.
That's great, and that's what we want to do. So if you go with that vitamin B, it doesn't get retained; it gets peed out as vitamin P.
You're exactly.
Not vitamin B.
Just got to be careful with fat-soluble vitamins. So so you can overdose with.
You can.
Like vitamin D, vitamin A, vitamin E. Those are stored in the fat. So if you take ultra high mega doses for long periods of time, you can actually end up with a hypervitaminosis syndrome type of thing.
What would be the symptom of that?
There'd be a lot of different symptoms. Sometimes it can affect the kidneys, so you may feel extra thirsty. You may actually feel more fatigued as time goes on, but that's also usually very, that's actually one of the nice things as well. Most family practice and most internists are checking vitamin D levels because certainly vitamin D deficiency is an epidemic, especially where we are and we're all inside more now instead of being outside. But yeah, they're checking it more, so now they can check to see if you're too high or too low.
So during the winter months, as this podcast is being broadcast, I go ahead and I'll take I think one drop is valued at maybe 1,000 maybe or something like that, and I'll do one under the tongue. I'll slap that in there. My multivitamin will have some in there as well. Say RDA, recommended daily allowance, whatever it may be, because I know the angle of the sun, days are shorter. You're not getting as much sunshine, and so on and so forth. You said about thirst too. I thought about that one day when you say you're thirsty, you keep doing it because really it might be that you have too much. You're over. You always think you're dehydrated, but you could be overhydrated.
Correct.
So watch that flow too.
Absolutely.
Keep that track, and that's why to fix all this, go see your general doctor first. You're the specialist, but see them and get the blood work up. And if anything checks kind of weird, there you go. We need to go see Dr. Champion or whoever it may be. I thought that was good. So I think, Axel, did you find anything intriguing here as a young man? I always have to ask our director to think. What do you think? Anything that kind of caught your eye or ear?
This has all been very interesting so far.
Yeah.
The fact that you brought up the vitamin D deficiency, it's mentioning it as a pandemic or epidemic is interesting because I'd always thought about it, but I never really knew if it's common or not.
Right. Incredibly common. And in fact, actually, what we found with a lot of the COVID work, going back to COVID, COVID infection, people who had a vitamin D deficiency were more likely to end up in the ICU.
And you heard about that. Yeah, that's crazy.
Wow. So
Now, his melanin and mine, more olive complected.
yes.
What's the difference between that and you, who are, being Caucasian too, lighter complected? What would be, is there a benefit or not?
So
or
more melanin tends to result actually in more vitamin D deficiency, especially
so we would
in
be
northern climates.
likely, and that would be me too when I was up north, because when growing up in the, you get cabin fever,
Right.
you're indoors, that kind of thing. The weather's not suitable to go out and enjoy the
Exactly.
sunshine. Anything to do with your skin complexion, your melanin, though? Would that have anything to do with it?
Just as far as baseline, in terms of you're going to be more likely to be vitamin D deficient with a darker complexion.
Okay, interesting. Okay, so that's good to know too. I mean, a lot of different little side things there. That sound good to you, Axel? Sounds good. I like that. I call him Axel Rose.
I like it.
I have a nickname for everybody. Axel
Absolutely.
Rose in the house. And he said, once bitten, twice shy. Was that White Snake? I can't remember. 80s? No, who was it? Who sang
Great
that?
White.
Great White. It was great. I knew he had
Right.
some white in there. 80s. My. Once bitten, twice shy, baby.
That's it.
That's it. So we learned a lot on that too. It's interesting. You can get almost an AED implant or whatever it would be underneath your arm. Somewhere would be less conspicuous, but it would make the athlete not be able to perform those duties anymore. But it could be something that could save your life. So again, back to Buffalo Bills. Bills Mafia here. You're talking to. So I want to see my man Damar Hamlin. I pray to God he can get back in next year. It'd be what a incredible miracle that would be, that he'd
No
be
doubt.
playing again next year. I would
Well,
love it.
just the fact that he's left the hospital, and
Yeah,
just
that's
the
huge.
fact that he
In such a
woke up-
short
woke up,
time.
yes, and
Yeah.
he woke up and his first. I think one of his first questions was, "Who won the game?"
Yeah, who won the game?
And his physician, I think, said, "You won the game. You won the game of life."
Amen.
Which
Oh, yeah.
really is. I mean, it's
Yeah.
to see, and it's actually relatively rare.
Yeah.
When we see people have sudden cardiac death, especially on the field or on the
Yeah.
pitch or whatever, it's to have someone come back to life is actually very, very important. I mean, it's good.
Sorry, you see, I'm ready to jump. I'm so excited about this, but I wanted to say sudden cardiac death. So did Damar actually? Did he have sudden cardiac death technically?
Well, I think the fact that he was pulseless,
Yeah.
and
So we can
and
say he actually
I would
momentarily died.
I would call it sudden death because they didn't have a pulse.
Yes.
I think to say that it's the cardiac was the underlying cause is a little bit difficult to say, at least at this point.
Sure.
I do think that's probably more likely going to be the underlying cause, but I think it's going to have to take whatever they feel, what they want to come out with, and that type of thing.
Do you think it's politics involved in that, or would it be something like that they have to be careful with?
Well, I mean, certainly HIPAA plays a big role, and
Sure.
kind of what does somebody want to say about their own health plan or health care and their health issues. But I think there's actually a lot of politics involved now with everything. And so,
good answer. I like how you answered that. I like how you answered that. I thought that was pretty good.
It's actually kind of a shame that we have to really think long and hard about the political side
it's just
of
ridiculous.
things.
It's involved in everything. But that I understand. It's your personal thing, and HIPAA is involved. I would suspect that because of the national attention on it, I can even see Mr. Hamlin himself coming out and saying, "This is what I have. I want to let other athletes know. Be careful of this and that and the other when it comes out."
I'll tell you a great example is Ryan Clark. Ryan Clark,
Yeah.
former safety for the
Yep.
LSU Tigers,
Another
and
one.
then was at Pittsburgh and Pittsburgh Steelers. He actually funded our Ryan Clark Center for sickle cell at University of Pittsburgh, and he had a problem when he went to Denver. And even at high altitude, he was not able to play in Denver because of the altitude, but lost a spleen and it was very touch and go there for a while.
It's got, I'm thinking, people with the Lions, Detroit Lions in his 70s, trying to think who that was. Remember, he was probably the only NFL player before that I know actually physically died from a heart attack out in the field as well. But you don't see it very often again. So that's what makes us so talked about.
Right.
The water cooler thing on that Monday morning, or excuse me, Tuesday morning. It was Monday Night Football. I think it was Monday night. Yeah,
exactly.
So it was one of those things that everybody was buzzing about it. Social media and everything else. But the big buzz for you, what would you say is the one thing that you would say, just to kind of pull it all together? What should we do, Dr. Champion? What do we got to do?
I think the key thing, just like we always say, listen to your body. If you've got a family member that's in intense athletics and things like that, just listen to them. Let them know the triggers that we would think about that would make us say, hey, all these kids tend to have a pre-athletic physical.
Good
where
point.
we can listen for a murmur or something like that. If we hear a murmur or we do an ECG and that advances things to an echo and those kind of things, we will certainly do those. I think if there is any question, though, I think it's always makes sense to see your primary physician. I mean, peace of mind is priceless.
Yes.
And again, try to minimize the risk. And so if we can do that, that doesn't mean everybody who's going into wrestling or football should go get a full echo and a stress test. But they should at least listen to the family history, their own experience, and then take it seriously.
Great. I liked it. Peace of mind is priceless, and
Absolutely.
it is with you. I appreciate everything you do, as always. We're going to see Dr. Champion again. He's always here with us. I'm honored to say I got you in my back pocket, so to speak, to answer these questions. It's been top of mind for so many. So for so many that would like to listen to more in-depth and incredible knowledge, a plethora of knowledge and papers that you've written, check out other past podcasts. You can search just Dr. Champion, Dr. Hunter Champion. To search it right here in the podcast play zone, you'll get all the episodes we've had with you, over the years. So we'd love to have you again very shortly. I know you're going to be back again, of course. We always talk about something. Okay, so check it out every week right here at WRBL.com, 7 o'clock. It streams 6 Central or whatever time zone you're in. But bottom line is just search it when you want it the most at, of course, Apple, iHeart, Spotify, anywhere you get your podcasts. We're on YouTube now, too. You're on YouTube right now. Look at that, Dr. Champion. So you can go to YouTube, also get it there, and we hope to see you the next time. Peace of mind is priceless right here on social media, too. You'll get a little snippet of it. You'll see us on Instagram, Dr. Champion, myself, Facebook, and Twitter. Thanks a lot, Hunter. Appreciate all you do. Keep up the good work.
Will do. Thank you so much.
Right.